Good afternoon, everyone. Thank you all for joining us. We're going to go ahead and get started here. Want to just do a quick introductory statement here at the start. Today we'll be hearing from Mayor Jenny Durkan first, followed second by Alex Greninger of UW Medicine and Virology, and followed finally by Dennis Worsham, King County, Seattle Public Health. And with not further ado, I will hand it over to Mayor Jenny Durkan.
Thank you, Anthony, and thank you everyone for joining us here today. I'm hopeful this will mark my last press conference as mayor of Seattle. But we are also tracking both winter weather and Omicron closely in these last 12 days of my administration. As we head into the holidays and at the same time an expected surge of cases, I really want to highlight two very important things that the city has led on: testing and vaccination. And both of those are so important today as we head into the holiday season with Omicron on the rise. All of us are still learning about Omicron from the scientists and researchers, but we know that it is here in Seattle, it is spreading quickly, and we are projected to reach a new pandemic case high as early as next week. But this winter is very different than last winter's surge because we have vaccinations and we have vaccine verifications and testing. As of Friday, we have one of the highest vaccination rates in the country at 90% of our population which has received at least one dose. Nearly 65% of kids 5 to 11 years old are vaccinated, and nearly 50% of those who are eligible are boosted. I really want to urge everyone, if you take one thing away from my press conference today, get vaccinated, and if you're eligible, get boosted. Unlike many other cities that are seeing a surge of the Omicron cases, we in Seattle do have a high vaccination rate, as we do in King County. We also have continued our free testing, indoor masking requirements, and vaccine verification. We are taking steps today to continue preventing the surge and resurgence of COVID-19. But we also know this virus is not done with us. This variant, as we predicted, was another one to come, and we have the tools to try to take the steps we can to stop it. We also know this fall that we opened up clinics in West Seattle, Rainier Beach, and South Lake Union. Those clinics have administered over 50,000 boosters so far. First, again, go get vaccinated if you haven't already. Join most of eligible Seattle that is vaccinated and who've already received their vaccination. Also, if you're eligible, please get your booster shot. It is shown that booster shots can be effective against Omicron. You can visit seattle.gov, and we'll put that out for people, to make an appointment, and we'll be adding more appointments in the coming days. You can also visit the Department of Health website, which has a vaccine locator to find appointments at pharmacies or healthcare providers. Testing is also going to be critical to determine when people are sick and when they should isolate from others. Please, go get tested, especially if you've been exposed through traveling or have any symptoms. We are pioneer testing, and we now have sites across the city by Curative and UW Medicine. Many major cities are struggling to keep up with the demand that Omicron has brought, but our partnership with the University of Washington has been so critical that we still have the capacity to test people in the city. Together, we have done more than 1.3 million free and easy tests in the city of Seattle. We lead all the other cities in our major testing and case per other major cities. It's free, it's easy. Please go get tested. Alex from UW will be here to discuss that, and he's ready to tell you that the UW is here to meet the demand, even as sites may get busy during the holiday season. I also want to acknowledge the work of the University of Washington who are helping to sequence and track this variant. One reason we can be more prepared against Omicron is we've been able to see it in our city. We've been able to test, and we've been able to prepare ourselves. Washington, specifically because of the work of the UW, is leading the way on sequencing and projecting the increase in cases. I know we will all continue to communicate the resources we have available for Seattle residents, but I want to urge people, we know how to take care of each other. If you can avoid indoor crowded areas, wear your mask, Get vaccinated, get tested. And with that, I want to turn it over to the University of Washington, Alex Greninger, who will tell you about what the UW is doing and its testing capacity. Alex, the floor is yours.
Great. Thank you very much, Mayor Durkan. It's really an honor to be here for your last press conference. So Omicron is spreading rapidly. Our most recent data puts it at 70% of all positive cases for samples collected last Thursday. Starting this week, we're expecting almost all positives will be Omicron, as well as to see a substantial increase in the number of overall cases. One key message regarding testing is that the Omicron variant does not affect our ability to detect the coronavirus. So we're able to detect COVID-19, same as before, does not affect any of our diagnostic testings. Now about capacity. Our analytical capacity has doubled since last winter. We can do 500,000 patient results per month, and our previous busiest month during the pandemic has been 300,000. So we've done a lot to expand capacity. UW Medicine runs 11 testing sites across the Puget Sound region. We have a high volume site at Sammamish State Park that just opened last week, and another high volume site opened in Shoreline last month. Those sites, Sammamish State Park and Shoreline, probably would have the shortest wait times right now. Our sites are open every day during the holidays except for Christmas and New Year's Day, and 3 of the testing sites are open on Sundays. So that's Sammamish, Shoreline, and UW. The easiest way to make an appointment is to go to our landing page by searching UW Medicine, or to go to Google and search UW Medicine COVID testing, and it should be the first results. We do ask people to complete online registration in advance of driving to dramatically speed the process up, though many of the sites do just take walk-ups. A testing site as well at City Hall is now open to the public. And I just wanted to echo Mayor Durkan's message first. Please get boosted and vaccinated. Seattle's done a great job during this pandemic, and testing is very important for your health as well as for us to have the data that gets reported to public health so our policymakers can inform their responses as we go along during this pandemic. We also genotype and sequence a substantial proportion of our positive. That's how we know that, basically going forward, most of these are going to be Omicron. But we've been able to watch that uptick, and that's one of the reasons we're here today. So with that, I wanted to thank Mayor Durkan and pass it back to the rest of the presentation.
Thank you so much, Alex. And I think Dennis Worsham of King County Public Health is now able to join us.
Hello, Mayor. Thank you so much. Sorry about the delay. I had a little bit of technical problems there. Just to echo Alex, it is really wonderful to be with you today in particular as you are ending up your tenure as the mayor, and couldn't thank you enough from a public health perspective for your leadership, your commitment, and tenacity, which has led us to be one of the healthiest cities in America under your leadership. So thank you. Thank you. Unfortunately, you're going out during a high point here with COVID, and I know it's news of this surge that none of us really wanted to hear, as we really have been working so hard to bring our Delta variant down over the past several months. As we know, it came in and it's been a slow, gradual decline of where we're at. And then as we move into the holiday season and end of year, of course, Omicron's coming in with quite a surge. Over the last week, cases have nearly doubled from the week before. So in the last 7 days, we have in King County have reported 515 new cases of COVID here in our community. This puts us back into CDC's definition of a high transmission, which is over 100,000 cases per, over 100 cases per 100,000 residents. So we have moved back out of substantial, back into a high transmission community because of this rapid increase that we have seen here in King County. We are expecting, as Alex has alluded to with what they're seeing at the labs, we're expecting to see an increasing number of infections, even among people who have had COVID in the past or breakthrough infections in vaccinated people. We can expect that most of these breakthrough cases that we're going to see will be really what we've seen because of Omicron coming in where it's at. We're doing great as a community as a whole. We are well over 80% fully vaccinated for 5 and older for those that are eligible, and pushing 90% of where we have initiated for 5 and older in our community. It's important, as mentioned by the mayor and Alex, it's really important for us to be really pushing the message of vaccines are very important at this time, especially as we go into this Omicron. We know that what we're learning about Omicron is that a small portion of these cases can be severe. And it's a small portion, and we're still learning a lot about it by looking at what's going on in our own country. New York, there was a lot of news breaking over the weekend, as well as what we've seen in Africa and in the UK. We know that there are effective steps that we have put into place. We're in a much better place as a community than we have been a year and a half ago, with vaccine proportions being as high as they are, with understanding about the importance of masks and the science that they have given us. So we need to be smart. We need to be really wise going into these next several weeks. When we gather with our friends and our loved ones over the holidays, is do it safely. Limit the number of people and that you're gathering with, and make sure that you are living in well-ventilated spaces when you do gather, and use masks whenever possible. And a high-quality mask is really critical at this point. We're really encouraging folks to get masks that fit well, that are like K95s or equivalent for getting a good barrier between you and others. The other thing we really want to encourage is testing, and Alex talked about testing a bit in his report out. We do know that there is a high demand for tests right now, and there's a variety of tools that we have, either at our on-site testing locations. We know that there are a lot of antigen tests now in the community through different providers and through over drug stores and pharmacies. It's important for people to test, know their status of where they're at, especially if they've had exposures or are not feeling well. We know that vaccines are also under a lot of stress right now. The good thing is the demand is very high. We're administering over 100 vaccines per week in the county, and we're up 50% from where we were in Thanksgiving time, and we'll increase that by another 20-30% here by end of week. So we anticipate having some eligibility of about 120 to 130,000 doses available in our community. It's really important for people to get vaccinated if they've not started, if they're eligible for their booster, to get their booster. We know that this is really going to be an important element with Omicron going forward. So that is what I want to share with you. I'll give it back to you, Mayor, and we'll help answer questions as they come in.
Thank you so much, Dennis. And I want to thank you. I also want to thank Dr. Jeff Duchin, who couldn't be here, but he has been working just tirelessly throughout the pandemic. My thanks and deep gratitude to him and to all the colleagues at the State Department of Health, but also to my partners across government, Governor Inslee, Dow Constantine. I think how we approached this pandemic was so critical to getting these results. But I also want to thank our healthcare workers. You know, they are 2 years into this pandemic and they are exhausted. And every time each one of us takes a step to protect ourselves or protect our families, we're also protecting those healthcare workers who really have been on the front lines of this pandemic for so long. And with that, I'll take any questions. Deborah.
Mayor and anyone else who wants to respond, since the citizens of this area are so well vaccinated, I mean, how can you put it in perspective? I know that you say we're doing better than some cities, but people are still getting sick. Omicron is still proliferating, and you expect now that the majority of cases within a week will be Omicron. I'm talking to people who are pretty level-headed, and they're panicking. They don't know what they should do, and they are vaccinated.
Yeah, that's a great question. The first thing, we don't want people to panic. We are taking all the steps we can as a city, but mostly residents and businesses are taking the steps they need. We know there's a lot we don't know about Omicron already, but we do know that being vaccinated provides some protection. It may not prevent all breakthrough cases, but the statistics so far show that it does usually result in a less serious illness, less likelihood of hospitalization, and lower mortality. So getting vaccinated is absolutely critical. And if you're eligible, get boosted, because they've shown that being boosted actually helps also against Omicron. The second thing is, we know, for example, that wearing masks helps in cutting down the transmission. So continuing to wear the mask indoors, limiting the number of people at your celebrations. It's not worth getting together if one of you gets sick. And so really try to limit the number of people indoors. And then also test. If you've been exposed or you think you've been exposed, if you've traveled or if you have symptoms, we have those testing sites, and we've shown that by testing and finding out who's sick, we can isolate them from other people. The reason Omicron spread so quickly is it's so much more contagious. And the way you stop that is to shorten the number of people or lessen the number of people who can be exposed.
Deborah, would you like to ask a follow-up?
I would like to ask a follow-up. And so then, in terms of testing, perhaps Dr. Greninger could answer this, or Mr. Worsham. When should people test? Whether if they have sniffles, if they cough 5 times, if they sneeze a couple of times, what is the standard for being tested? And are you prepared if everybody decides to run out every time they have to clear their throats?
Thank you for that question. It is look, it's a dynamic environment. So, I think first off, for symptomatic individuals, if you have a fever, a cough that, again, we want to get people tested early, so we don't want people to wait for a long time. I think it's important if you have symptoms, of course, to isolate, right? At some level, that's really the most important thing to prevent onward transmission. But getting testing, there's a lot of things circulating. We have flu, we have RSV, we have rhinoviruses, we have even other coronaviruses. So, that's why, testing specifically for this virus is also important. The other use cases in the case of being exposed. If you've been exposed and, most of the time you want to let symptoms be your guide, right? It's really hard. Omicron is difficult because it has a higher percentage of individuals who are asymptomatic. And so that that's, in a way, it's good news, but it makes it harder from a standpoint of transmission. And I think it's very hard to specifically know when you're testing asymptomatically to know when the right time to get tested. I think really you have to follow then exposure, signing up for the notifications on your phone, and other information there. I also want to echo, there's definitely a role for rapid testing here as well. It takes all testing modalities come together to help us. So I think symptomatic, certainly fever, cough, and this is supposed to be a little bit more of a little bit more bronchitis-y picture for Omicron so far as what I've heard for the most part. I don't know if that answered your question in full. I'm happy to take it offline or follow up later.
Thank you, Deborah, and thank you, Dr. Greninger, for the answer there. Quick reminder to folks who are joining us virtually, I will call on your name and I will unmute your microphone. You will ask your question, I will mute your microphone again, and then when you have opportunity for a follow-up, I will cue you in once again. We're going to start off today with Nicole Jennings from Cairo Radio, and then we will be hearing from Elise Takahama, Seattle Times. Nicole, the floor is yours.
Good afternoon. We've been hearing that as people prepare to head home for Christmas and get tested, that it's very hard to find test kits in stores. What can you tell us about this, and how is the city planning to help this problem so that people can get access to those really quick home tests?
So the question is, people are having a hard time finding the home tests in the pharmacies, and what is the city doing? First, if you're able to do it, as Mr. Greninger said, it is a great first step to see if you should screen yourself. If you can't get it, don't panic. We're really hoping that the federal government does step up as promised to produce a number of these and provide them across the country as well as in our community so that there's more access to this rapid testing. In the meantime, we have shown that our city people are using very good judgment about when to get tested. And during the pandemic, we have seen people use our testing sites. As UW said, they have more capacity. If you've got symptoms, first isolate. And if you get to the point where you think that your symptoms are severe or that you might have it, go get tested, because that tells you whether you need to isolate for a longer period of time from loved ones, from coworkers, and the like. So we are working, we will hope that the federal government can distribute these home tests more rapidly. But in the meantime, people shouldn't panic and think that because they don't have access to those home tests, they do not have alternatives. Dennis, do you want to add to that?
Yeah, thank you. Your message is right on. We're also trying to work as a region here, as the mayor said. The federal government has put some funding into this. We just haven't got the flow yet into the state. The way that they will we should be able, as a state health department, to be able to purchase those tests and then disseminate them in the community. It just has not come on as quickly as we said the federal government said they were going to be doing. So we are trying to find our own kits, and we will definitely distribute those as we see those. But what I'm hearing from reports from several folks is that they are in pharmacies. People are seeing them in pharmacies. They are seeing them online, and there are some available in our community. So between the two, we'll definitely get them out where they're needed.
Yeah, and I think I'll add to that is, if you see them, take the few you need. This shouldn't become the toilet paper of today. We don't need anybody clearing off the shelves. Let's really make sure that we approach this reasonably as a city.
Thank you, Mayor. Nicole, follow up.
Thank you. If a person does test positive with one of those home tests, how should they report that? And is that an issue with people not reporting it, not being honest?
Dennis, I'll let you answer that question.
Yeah, I looked like Alex was going to say something as well. Alex, did you want to say something? Then I'm happy to follow up.
I would just say it's less of a question of honesty and more just the ability, the way to report it, the workflow. So I think the first thing from a central laboratory standpoint is all of our results, positive or negative, flow electronically in real time to the Department of Health, to King County, and so policymakers and epidemiologists and local health, public health can know that information. So my one of the things to say is that if you do test positive by a home test, you can sort of register that test. I mean, there are apps that different manufacturers make that will report that to public health, so you can do that. Another option is actually to get just collected and tested at one of the collection sites as well, because those results will go straight to public health as well.
Yeah, the one thing I will just add to Alex's comment is if you do test positive through one of those tests, the most important thing is the call to action. It's to notify people who you've been around, to let them know so they can also isolate and quarantine. That's what a positive test helps us to understand, is through our contact tracing and information. So if you've done a home test kit and you've tested positive, just be responsible as you are. That's probably why you're testing, is to let your friends and family and coworkers know that you've been exposed so they can isolate and we can interrupt the transmission that's taking place.
Thank you very much. Our next question will come from Elise Takahama, Seattle Times, followed by Steve Salas, King 5. Elise, the floor is yours.
Good afternoon. Thanks so much for being here. I'm wondering if, as we're learning a little bit more about this variant, if there's any sort of specific updated travel guidance that people should know going into this week and this weekend. I think that, a lot of people are expecting to be out and about. And so is there anything that can help them kind of rethink some of those plans if needed?
Great question about travel guidance. Dennis, do you want to answer that first to talk about the Department of Health, King County Public Health, and CDC guidance on travel going into the holiday week?
Yeah, we haven't seen a lot of new guidance come out. What we're emphasizing with folks, if you don't need to travel, don't travel. If you don't need to gather, don't gather. And those are really about important messages just about knowing that how transmissible this is to reduce your risk factors as much as possible. But there's been no direct guidance been given as far as requirements or regulations have been put into play.
Elise, follow up.
Sure. So actually, this is on a separate note, but Alex, you mentioned earlier that about 70% of positive samples are coming back, likely Omicron. So can you kind of tell us a little bit more about how many, if there's been an increase in samples coming into, anything else about that?
Sure. So yeah, the new data point from today is that samples collected last Thursday, we were at 70% S-gene target failure, which is a certain test that is a sort of a hallmark for Omicron. At this point, with that high percentage, it's almost entirely synonymous with Omicron. And we've been following that now for the last 2.5, 3 weeks. And it's basically gone up as a percentage of total positive cases, essentially gone up in an exponential fashion. So, I mean, in the last week, it's sort of blown through from 10% to 70%. And again, this is sort of a little bit of a lagging indicator we're talking about last Thursday. So, starting today, I mean, I would expect that basically almost all of our cases are Omicron. We follow those by different genotyping assays, by different PCR assays, and then we also sequence them. But with a variant as fast as Omicron, the sequencing almost can give a little bit of such a delayed picture that we're really focusing more on these genotyping tests. And so, going forward, I think you really just have to, we'll still be doing those sequencing, and we'll get a population picture of what's going on. If anything changes, we'll find out. But going forward, you've got to really assume that pretty much almost all the cases are Omicron, almost all the cases.
Thank you very much. Our next question will come from Steve Solis, King 5, followed by Cole Miller, Como. Steve, the floor is yours.
Thank you. So the question I have is based on some searching I did today. So it seems that there is high demand for testing all across King County. And if you go to any of the testing sites, you will see cars lined up for blocks. If you try to sign up online, there are very limited to no times or dates available at a lot of testing sites. Finding an at-home test is like finding Wonka's golden ticket at this point. It's very, very difficult to find. The questions I have, it's actually a two-part question. One, are there any plans with this variant being what it is and with testing at such a high demand, any plans to expand hours, dates, or locations for testing? And the second question is there concern because tests are so tough to get a hold of, and right now, let's be honest, time is not a lot of, we don't have a lot of time during the holidays, let's be honest. So that being said, is there concern that people won't get tested? They'll just kind of write off whatever they have as maybe a cold or the flu, and that may skew some of these numbers?
I'm going to let Alex tackle that, but I did want to, that's a great question, but I want to confirm again, we have more capacity right now, and the UW has the ability to increase the number of tests. As Alex said, they've stood up throughout King County some additional sites. Alex, do you want to talk about testing and the capacity to meet the demand?
Yeah, so as I said, I think the most recent information, or sort of as timelines change for when appointments are available, the best place is the landing page for UW Medicine COVID testing. That's what you would Google, UW Medicine COVID testing, and that'll sort of get you there to different places where you can sign up. We think that Sammamish and Shoreline are going to be the sites where there's the shortest amount of time, of wait times, and there are available appointments there, as well as there are some walk-up sites as well. So that's by far the best landing page and area to start from. I'll report, just personally, I went on yesterday and ordered some rapid tests. I think, we're expecting more cases, so I wanted to have a few more here at home, and was able to find some that were shipped supposedly today from Walmart online, So, I mean, it does a little bit of more of a hunt. I'm not saying it's always easy, but still it's possible to find these things. And our job is we have expanded our overtime for our individuals we're collecting, as well as in the lab for individuals analyzing specimens. So we have been anticipating, we've been following the math, and I'm not going to say that we know what's going to happen in the future, and exponential math is punishing. But nonetheless, we have prepared as much as what we can to be ready for right now, this week. Today is the day we sort of marshaled many of our resources, and we expect the next several weeks to be at this very, very high level of testing demand with the capacity that we've built up.
And I would add to that, if you go to the City of Seattle website, we also have the curative sites citywide. There's a new site, testing site in City Hall for those who are downtown. So I would urge people to go to both websites. And again, UW will prioritize people with symptoms because we really want to make sure that the people who might have COVID are tested first. But we do want to make sure that people have access to testing.
Steve, follow up?
Any messages to people as they wait in these lines? At one facility, I saw a number of people cut each other off as one guy get out of his car and confront another driver. Any messages for these people as they are, all essentially after the same thing?
Yeah, I'd say we made it this far by taking care of each other. And as depleted and exhausted as people are, and the holidays are always hard anyways, people just need to take a deep breath and exercise kindness. You will make it through the line. You will get tested. The good news is we have free testing. And we have access to testing and capacity that they don't have in many major cities. So take your time, get tested when you need to, but please be patient and be kind to each other.
Yeah, one thing I just would like to add is you do have an ability also to schedule appointments. So if folks want to get on and schedule appointments, you can do that as well. If you don't want to just risk the time of being in line and waiting, those appointments are available online as well.
I'd also just add that, some of the sites, they're, old vehicle emission sites and whatnot, that, just the design of them makes it hard when there is a line. So like the Aurora site will back up to Aurora, and that's not the best. So we're trying to encourage people, especially in the north part of Seattle, to look at that shoreline site, to move there because we have, or to be tested there, because it just has a much better plan overall if you do end up in a little bit of a line.
Thank you all for the responses. We have one more question from Cole Miller from Como. So Cole, the floor is yours.
Very good. Can you guys hear me?
Yes, we can hear you, Cole.
Okay, thank you very much. I appreciate y'all taking the time this afternoon to do this. I had a quick question or two regarding future variants. I'm not sure how you'll be able to answer. I don't want speculation or anything like that. But my first question is simply, as we plan, I would imagine, for variants down the road, what can science and vaccines do to potentially keep us one step ahead of potential future variants? Or what kind of research is being done on that front?
So that's a great question, Cole, and there's been a lot of research that's being done. Some of it led right here out of Seattle. I'm not an epidemiologist, but by now I feel like I could almost play one on TV. We know vaccines work, and we know boosters work. Just this morning, Moderna released the preliminary results of a study that isn't a full study, but that shows, for example, that the booster of Moderna does offer protection against Omicron. And so we know that vaccine and being boosted works, wearing a mask works, not gathering inside in large groups unmasked is really important. I've said it throughout this pandemic, this virus is not done with us yet. And this is a variant. We expect there to be future variants. But one thing that people are studying right now is that Omicron is much more contagious. And as Alex said, it is likely it will be 100% of the cases here in our region today, if not soon. At the same time, if vaccines provide the protection, it could be that by overtaking Delta, which seems to have more serious effects, it could in the long term be getting us to the point we need where we can normalize as a population.
Cole, follow up.
Thank you, Mayor. Like you, I am not an epidemiologist as well, as though over the course of the last year and a half, it feels as though we're all becoming one to a degree. My follow-up question was, as viral evolution continues, is it possible that we're getting to a point where some of these breakthrough infections may happen or continue to happen, but they will be minor? I've heard some research, a virus doesn't necessarily want to kill its host, that otherwise it cannot replicate or move on from person to person. So down the road, is it possible that they continue to maybe be more transmissible, but are less severe in terms of how they impact the body?
Yeah, thank you, Cole. I think we don't know enough about the research yet. Preliminary indications are it is much more transmissible and highly more contagious. So therefore, we'll have many more cases. And as a result of that, we may have more people who get sick or enter the hospital. But the indications right now are that having vaccine, particularly a booster, does add protection against serious disease and death. We don't know enough yet, but we think there is that protection. So that's why it's so important for people to be vaccinated and get boosted.
Thank you very much, Mayor, and thank you to our press who joined for asking questions. That concludes the Q&A portion of today's press conference. Mayor, would you like to close us out with any final thoughts?
Yeah, I would just like to say in close again, my thanks go to the people of Seattle, the businesses and the residents who every step of the way through this pandemic have done really hard things and have done what they needed to do to protect our community. Whether it was the small business owner who dipped into their own pocket so that they could pay their employees and keep them employed for a period of time, or employees who lost their jobs but then went to work feeding the community. Every step of the way we have seen all these inspiring acts of kindness, but we've seen real bravery in the face of this pandemic. And we are not done yet. We're not out of the woods. I want everyone to know that my administration has worked closely with incoming Mayor Harrell. We have offered all the resources we could to brief them on the COVID-19, And they will work as closely with King County Public Health and the other leaders so that we can continue on this fight against COVID-19. It is a voracious virus. It is not done with us yet. But if we take the steps that we know work and are smart, we can continue as a city to lead the way for the country. Thank you very much. I hope everyone has good holidays.
Thank you, Mayor, and thank you to Dennis and Alex for joining us here today as well. That concludes this afternoon's press conference.